Cutting through the din of digital rumors has become increasingly difficult in the age of information disorder, especially with the recent outbreak of the coronavirus disease, which continues to test the boundaries of the quest for objective truth. A misleading source-hacked message, falsely attributed to an online news site of a case of the novel coronavirus, quickly went viral Sunday, March 8, 2020. It was all fake news. The situation was diffused by an accompanying voice note from the Prime Minister's attaché, categorically debunking the claims of a COVID-19 case. Authorities are beseeching the public to get their information from credible sources and avoid sharing and posting stories and claims of questionable validity. Chief Medical Officer Dr. Sharon Belmar-George is also warning the public to steer clear of trafficking in conspiracies, the spread of misinformation and disinformation, including erroneous claims about immunity based on race. She explains that travel history remains a major factor in the spread of the virus.
The Department of Health and Wellness has been informed of some acts of discrimination towards people who appear to be of Asian descent. Although coronavirus did originate in China, it is important to note that the risk of being infected depends on person's travel history and irrespective of race or nationality.
The chief medical officer, who recently accompanied Prime Minister Alan Shastney on a trip to Miami to meet with cruise line executives, says the authorities are implementing safeguards for the industry.
There has been confirmation of COVID-19 cases in several Caribbean countries, including Dominican Republic, St. Martin, St. Bartholomew, and most recently we note Martinique. The U.S. State Department has issued a cruise travel warning against travel by cruise ship. The CDC has noted the increased risk of COVID-19 infection in the cruise ship environment and has cautioned travelers, particularly those with underlying health conditions, against situations that may put them at increased risk for more severe disease.
Dr. Belmar-George affirms that preparations are ongoing to bolster the island's capacity to respond to the epidemic. She says Saint Lucians' diagnostic capacity will be strengthened through the recent order and shipment of testing equipment.
The ports of entry have also been strengthened with additional public health staff to enforce the relevant regulations and protocols and to ensure the health of the Saint Lucian public. On Friday, March 6th, the Chief Medical Officer accompanied the Prime Minister, Honorable Alan Shastney, to a series of meetings with the cruise industry in an effort to discuss guidelines and protocols of both parties to facilitate a mutually beneficial agreement. These meetings proved quite fruitful.
The Ministry of Health encourages Saint Lucians to avoid panic, given the proximity of 2 cases of COVID-19 in neighboring Martinique. The ministry implores the public to adopt good personal hygiene with frequent hand washing to reduce the risk of contracting the virus. Solange Alfred, HTS News Force.